Hello, my name is Tanya Bradford, and I'm here today to present my evidence-based project. Here's my poster, and I did my evidence-based practice change on the effectiveness of restraints in patients over the age of 65 while they're in the hospital. Um, Restraints are often used in the hospital setting to keep patients from falling. When elderly patients over the age of 65 get in the hospital, a lot of times that's a new surrounding, or they're on new medications that they've never taken before. A lot of them have surgery, so they're under the influence of coming off of anesthesia. So a combination of different things can cause a patient to become confused. They also could have baseline dementia. So in a hospital setting, sometimes that just kind of exacerbates it. And so keeping the patient safe is a number one priority in the hospital. And so I wanted to see the effectiveness of restraints and if that's really kind of an avenue that we should be using in the hospital. One of my statistics I found that reported prevalence of physical restraints varies from 7.4% to 17% use in acute care settings in the hospital. Risk of falling, agitation, and wandering are often experienced in the hospital and in the hospital setting. The use of physical restraints also comes with risks. There could be skin breakdown where the actual wrist restraints or leg restraints are used. Skin integrity is important to be monitored closely by nursing staff. So that's important. Also, the integrity piece of restraints, a lot of times family members are uncomfortable with their loved ones being in restraints. So those all have to be a factor if they're, if that's the best avenue to use a restraint on a patient. I know I work in a busy med-surg floor, and we have used restraints on patients to keep them safe and from falling, because falling can cause all kinds of troubles for a patient. They can break a bone, they can have skin tears, and we just want to keep our patients safe and in the bed. Physical restraints can consist, like I said, of wrist restraints, of ankle restraints. We can also use vest restraints. Also, using that fourth bed rail on the beds is also considered a physical restraint, which they all require a doctor's note to have a restraint when they're in use. I did do a case sample on Mrs. S while she was in the hospital. She had actually had her gallbladder removed, and she had a baseline history of dementia. And on that first night post-op, Mrs. S got confused, and she actually, had the bed alarm set, and she was found on the floor from nursing staff after the bed alarm had gone off. If an order had been obtained prior to her falling out of the bed to use that fourth bed rail, that could have prevented Mrs. S from falling out of the bed. So that could have been a first line defense of restraints, is using the bed rail prior to trying to use like a wrist restraint where she's actually physically tied to the bed. That fourth rail is a good starting point with the restraint. Patients who are at a high risk for falling and injuring themselves can really benefit from restraints if they're monitored closely and used properly. It has been known, and it is a proven fact, that it can keep a patient safe and in the bed. Recommendations actually for using restraints. On a particular med-surg floor that I work on, it would be important to have all staff trained properly on how to use restraints. There is, important avenues that they're tied properly to the bed. So in a slip knot, so if we have to get the patient out of the restraint quickly, we can do it. Skin integrity is very important, that staff is trained properly on how to monitor skin and skin breakdown. Also, there's the factor of when patients are in restraints that they are loosened and that skin under the restraint is actually monitored closely for any breakdown and loosened also. And it's important to continue to turn the patient in the bed. So that's why it's important to loosen the restraints and chart properly to the restraint. So it would be important that all staff members are trained properly and feel comfortable on using restraints. I think a lot of times that staff are uncomfortable with doing certain procedures because of how effective they can, how they've been trained. And just like anything else, if they're not using those skills, it might be a little more difficult in the time when you have to use the restraint, that they don't feel comfortable tying the restraint or putting the vest restraint on properly. So it would be important to train all of the staff and keep them up, through doing like a one link where they're or on a competency with the education committee, that staff is always comfortable and using the restraints. And another important piece is charting on the restraints, that there's close monitoring and you're charting and documenting exactly what is going on with the patient at the time, why the restraints are used, and also keeping the order up from the physician that you're renewing that order every 24 hours. So these are all important pieces of using restraints on our patients in the hospital. As far as future directions, that there would have to be the restraints actually available for staff. They would know where to find the supplies when they were needed. It would also be important to have upper management and management on board, that everybody is on the same page as far as using the restraints and using them properly. There would have to be the budgeting for education, and it would be important that that staff would know how to actually put on the restraints, and they were checked off in a orderly fashion. So all of these are an important piece in the effectiveness of restraints on elderly patients. I think that restraints personally can be a great avenue for keeping our patients safe. I've seen several patients, unfortunately, after having surgery, falling, and because they're so confused, they don't realize that they're in the hospital. But it's also important that the right documentation, and we're really monitoring those patients closely. That's important key, and the integrity that, we're keeping family members, we're keeping them educated, and we're keeping them on board as far as what's going on and why we're using them. I think it's important that we tell them that our number one goal is to keep their family members and their loved ones safe. So that's important that they're on board, and that they're comfortable with having their family members in restraints. I think that that's all important. Part of the key of making it a success and the ultimate goal of keeping our patients safe. That's what we all want. We don't want, them harming themselves. They're already there under stressful conditions. And so just by keeping them safe, that's our number one goal. And if the least amount of restraints that we can use, we start out with that by using that fourth bed rail. And then if we have to use wrist restraints, vest restraints, that we use the proper channel of going through, of administering the restraints, and having staff comfortable with actually applying the restraints. Okay, thank you so much.